Happy Tuesday! Welcome to another edition of Anatomy Class. Hope you've had a good day. Last week we talked about the neck, the soft tissue neck, the bones in the neck, and a few arteries toward the head in the neck, a little bit of here across the shoulders. So I thought instead of going on to the T-spine, thoracic spine, chest area, we would continue with the vessels. It would probably make more sense to go over, I know last week we did the internal carotids. We're going to go ahead and do the carotids again with a little bit more detail. We're going to be going over symptoms of a stroke. Very important to know in case it happens to you or someone you know and love. What to do, that sort of thing. So we got a little bit to cover. It may be a little bit longer than last week. I'm not really sure. But it's a lot of information, and I hope it's value to you. We're also going to be discussing a little bit of the vessels around the heart, not in the heart proper. We might go over that next week as we go on down further into the body inferiorly. If you remember from our lesson number 3, inferior, superior. So that will help us also to know which direction the vessels are going, inward, outward, whatever. So without further ado, let's get started with our anatomy lesson for this week. On the arteries in the brain, a little bit of arteries in the brain, as well as arteries in the neck, and a little bit of the chest area. Also stroke, okay? Here we go. At the base of the brain, we know where that is, the carotid arteries and vertebral arteries. Remember last week I told you that the vertebrals live in the cervical foramen, as well as the nerves. So we'll go a little bit about learn about the vertebral bodies as well. But I'm going to try to focus primarily on the internal carotids because those are going to be most important for what we're discussing today. Okay? At the base of the brain, the carotid arteries and vertebral arteries come together to form the circle of Willis. In medical profession, MRI, CAT scan, we just call that the COW, C-O-W, circle of Willis. I am going to have a few drawings, so in a second I'm going to turn the camera around so it will not be backwards to you. The circle of Willis, and we're going to go over some things about that, okay? Here we go. Circle of Willis. Turning you around. Circle of Willis as we discuss them. Okay, so the carotids and the vertebrals are going to come together to form the circle of Willis, or the COW. This is a circle of arteries that provide many paths for blood to supply oxygen and nutrients to the brain. The carotid arteries supply blood to the brain and face. The right common carotid artery originates from the brachiocephalic artery. I'm going to show you that again from last week in just a second, okay? In the neck, while the left common carotid artery arises from the thorax, from the arch of the aorta. If you review last week's stuff, we talked a little bit about the candy cane structure that is called the aortic arch. And that is what we're talking about here, that the left common carotid artery arises in the thorax from the arch of the aorta. Okay? Let me turn you back around just a second because I want to show you what I'm talking about. 1 second. Here I am again. Let me get my drawing of the aortic arch so you will know what I'm discussing. I am going to turn this back around one more time. I'm going to show you the left subclavian artery also the brachiocephalic, the aortic arch, and a few others, okay? Here we go. Let me get you situated one more time. All right. If you remember, we talked about the candy cane last week. We talked about the internal arteries, left and right. They also branch, but we're going to see more of that in just a little bit longer, a little bit later. So the carotid arteries, you'll see those, right common artery. It's common because it hasn't bifurcated or split in between the internal and external vessels, okay? Same as the left common because it has not bifurcated into the left internal carotid and the left external carotid, okay? So here we are again. So the carotid arteries supply blood to the brain and face. The right common carotid artery, once again, originates from the brachiocephalic artery. The right common carotid artery, okay, cephalic artery is where it starts. The brachiocephalic in the neck, while the left common carotid artery, right there, arises from the thorax, from the arch of the aorta. So you see the left common carotid right here is coming straight from the arch. But over here, the right common, the subclavian, comes off of there. Brachiocephalic, we have the common carotid, but it's brachiocephalic, okay? So what happens, let me turn you back around a second. So what when an artery is clogged? Say the internal carotid artery is clogged. Well, let's find out. What happens when an artery especially in the brain, is clogged, that can create a stroke, okay? A stroke can happen when plaque causes the artery to be blocked, and that area is deprived of blood supply. This can cause damage. If you ever had a stroke before or known someone that had a stroke, we're going to get into different kinds of strokes in just a little bit. But what happens? There's no blood supply or limited blood supply, or sometimes a slow blood supply to the brain. The result for no blood supply, especially no blood supply, is that part of the body is controlled, So say your arm, okay, your hand, your arm, if that artery is clogged and there's no blood supply going to it through these arteries, and we're going to learn which one sends blood to the arms in just a little bit, okay? The result is The result is that body part of the body controlled by the damaged area cannot work properly. So once again, if the artery that supplies the blood to the arm, I'll say my right arm, may look left to you, if the blood supply is limited, stopped to the arm, damage can occur. You can lose the arm, say in an accident, stroke, it may not work anymore. You can't move your arm freely anymore. Parts of your arm, you may feel parts of your arm and parts of your fingers, you can't. That is the reason, and the reason is because you have limited or no blood supply to the arm. In this case, this example, it could be a foot, it could be a face, it could be anywhere, okay? Loss of blood supply. Even organs, they lose blood supply, they're going to be damaged, they could stop working, limited function. So we have to keep that blood supply going, Okay? The most common artery involved in an acute, we learned, 2 weeks ago? Acute means it just happened. It's happened recently. The opposite of acute is chronic. That means it's happened a while ago. Could be a week ago, a month ago, years ago. It's happened before. We call that chronic. So an example would be you had back pain, you had a car accident 10 years ago, but you're still having back pain. If you go to your doctor, he'd say, oh, patient complains of chronic back pain. Okay? Acute means it just happened. It's happened recently, like really recent. So we call that acute. Okay? So the most common artery involved in an acute stroke is the MCA. That's the initials, which means middle cerebral artery. Once again, the most common artery involved in an acute stroke is the middle cerebral artery, or the MCA. Once again, we learned that it branches from the internal carotid. Internal carotid. So let me get my picture out again. Let's figure out where the internal carotid is. And the right, we said right common. I'm sorry, the middle cerebral. Let's find our middle cerebral. I'm going to turn middle cerebral. This little artery right here is the most common artery involved in an acute stroke. This little puppy right there, middle cerebral artery. Does not mean that strokes do not happen in other arteries. I want to make that clear. Does not mean that other arteries, the strokes cannot happen in other arteries, because they can. Okay? But I found this very interesting. The most common artery involved in acute stroke is the MCA, middle cerebral artery. Now let's try to what the warning signs are for a stroke. Warning signs of a blocked carotid artery could be anywhere, internal, external, MCA, whatever. But the warning signs of a blocked carotid artery symptoms might not be noticeable. Okay? If it's at the blockage, think of you're on a highway and you're in traffic and you're going. Then all of a sudden you're slowing down. You're like, why are we slowing down? Well, the road may not be totally blocked. There may be a car you can kind of get around. Okay? That can happen also in strokes. Okay? They can be totally blocked. There's no way getting around it. The accident, the car's stopped or whatever. That's a different kind of stroke. But we'll go over more strokes in a second. But just know that the warning signs of a blocked carotid artery symptoms might not be noticeable until it becomes serious. Okay? So if you're going down the road and the car in front of you has a flat tire, it's going to slow you down for a minute until he or she gets over and you're going again. Okay? So it may not be permanent at the moment. It may not be serious at the moment. It can get serious later. Okay? So it may not be noticeable, the blocked carotid artery, until it becomes serious enough to deprive the brain of blood. The brain needs blood. The organs need blood. Everything in your body needs blood of some kind, of some some way, okay? Symptoms. So what if these symptoms become serious enough that you start having signs? How would you know? Okay? Symptoms of sudden numbness, weakness in the face, in the extremities, your arm becomes tingly, numb, okay? Your face, one side of your face, and most of the time, the weakness, the numbness, all of that, the droop of your face, only happens on one side. So, an example that it probably is not going to be, your right side of your face may droop, but your left arm is not going to be numb. Okay, it's normally on one side because you're having a stroke, possible stroke, on one side of your brain. Because usually only one side of the blood is not flowing freely. It's going slower. It's blocked. It comes and goes. That sort of thing. It's usually on one side or the other. Okay? Makes sense? So, facial droop. And we're going to go over how you can use an acronym to kind of judge if someone you know and love is having an acute stroke or if yourself is having an acute stroke. Okay? So how do we reverse it? Say someone you know is having a stroke. Well, obviously you're going to get them help, correct? But let's see in a second how we can reverse it. Okay? So a medicine that we use in radiology is called TPA. And what it does, it stops whatever the clot is, it dissolves the clot. Because obviously there's something causing the roadblock, right? Something has to be causing the roadblock. Is it plaque? Is a little piece of plaque has come loose and it's lodged somewhere and the blood can't get through? Or is your vessel's like a tube of almost spaghetti, but not really spaghetti. A tubular structure, has the plaque attached to the sides. So this is your artery. Do you have plaque on either side or both sides that's making the blood, it's called stenosis. The medical term stenosis. It's making the blood go toward the middle, and it's not using the whole entire vessel. Okay? It's blocked on the sides. Not blocked so much this way, but it's blocked this way. So it's a narrowing. Okay? The plaque is over here, and the vessel needs the whole thing, but the blood can't get through all the way. Like in your plumbing. Okay? If you have something in your pipe, it may clog it up all the way, or it may just be just enough to where a little bit gets through and it's hard to flush, whatever, okay? So, we can use a medicine called a clot buster or TPA. There's different names for different kind of medication, but they all do the same thing. They try to dissolve the clot or the plaque or whatever is causing the narrowing that's causing this stroke, okay? So, we want to restore the blood flow to the brain, okay? This technique is called thrombolysis. Thrombo means vessel, vein, thrombo, okay? Thrombolysis. Lysis, we're trying to cut it, okay? Thrombolysis. Without the medicine to dissolve the blood clot is more likely to cause serious brain damage. Very important on acute stroke. If you're having some symptoms I'm getting ready to describe, get your loved one, get your friend, get your coworker, get whoever is you find on the street, even yourself. If you start feeling, hey, my face looks like it's drooping, or my speech is just not like it was 10 minutes ago, 20 minutes ago, whatever. Very important. Call 911. You've got to get to the ER to get this TPA started. If in fact it's a stroke, could be other things. I'm not a doctor, but you have to get the TPA going through an IV, okay, in an hour or less. That's the magic time. This TPA has to be started within an hour for it to properly do what it needs to do. Now, I'm sure hour, 5 minutes, you get there, TPA started within an hour and 5 minutes, maybe it'll work. So I'm not a doctor, it's not medical advice, just an hour, okay? You have to do it now. Now. Another sign that we use in the medical profession, an acronym or letters that we use, is FAST. F-A-S-T. Stands for face. F is face. Face. Is the smile even? If it's this way, could be a possible acute stroke. Get it checked out. A is for arms. You want to raise your arms. You want your family member, your friend, your colleague, or whoever on the street, raise their arms. Can they raise their arms level? Okay? Does one fall? Okay? Does the other one fall? Are they weak? Looking for weakness. Okay? Arms. S, speech. It's very important. Are they slurring their words? Are they having trouble with their words? Can they not say something they normally say? Okay, your name. Can they give them a sentence or a phrase? Can they say it? Don't give something they can't say before, obviously. But if they normally say this phrase, or, I like ice cream, for instance, okay? Can they say, can they repeat back to you, I like ice cream? Okay? Anything like that, okay? That's the speech, okay? T. So we have F-A-S. We're on T. Time, okay? What time did this start? What time did you notice your friend slurred speech? What time did you notice they had facial droop? What time did you notice they were weak in their arms? They were dropping. They picked up their coffee cup and they just fell. Okay? Could be a sign of an acute stroke. May not be. Once again, not medical advice. I'm just saying, look for those signs. F-A-S-T, time. Time also means you got to get them to the ER. You got to call 911. Okay? Got to get them to the ER. You got that hour to get that TPA started in that IV. They have to have exams done, radiology exams to rule out a stroke. Okay, you gotta get there. Gotta get them there. 1 hour, less than an hour. You gotta go. Okay, time. All right. When they get to the ER, when you get to the ER, whoever, your friend, your coworker, whatever, family member, like I said before, your ER doc is going to order a CTA, a CAT scan, special CAT scan with some IV contrast in the line, okay? They're going to inject some IV contrast really fast to look at the arteries to see if, in fact, all the vessels are open or not. Your internal carotids, external carotids, your vertebrals, all up here in your head. Make sure you're not having a stroke caused by a blood clot, okay? Plaque, stuff like that, okay? When they get there, or when they're on the way, if they're in an ambulance, the ambulance people are going to talk to the doctors in the ER, whichever ER you go to. They're going to call a code stroke. Cold stroke means CT scan, get ready. X-ray, get ready. Neurology, head doctors, vessel doctors, y'all get ready. This patient's coming. The window starts as soon as they hit that door. We got an hour. We got to go. Let's go. Okay? Cold stroke. Don't let that scare you. That means everybody on the other side of the help where you're going, they're going to be ready. Okay? They have to be ready. They've got just a short amount of time to get you in. A lot of things are going to happen really quick. Okay? You're probably going to have an IV already from the ambulance people. Or if they're driving, someone's driving you, please don't drive yourself. Whoever taking you to the hospital, as soon as they know it's a cold stroke, things are going to happen quick. Okay? Don't let it scare you. They're going to take good care of you. But it has to go fast. I cannot stress that enough. Don't be scared. It's got to go fast. Remember, we have that hour to get that TPA in, if that is actually what is going on in acute stroke. Okay? Carrying on. There are several types of strokes. Okay? I'm only going to name them, but I'm only going to cover in detail the top 3. Okay? Just for the time purposes, the top 3. There's ischemic, there's hemorrhagic, there's transient ischemic attack, also known as TIA. Some people call them mini strokes. Okay, TIA, all right? There's also brainstem strokes. There's also cryptogenic. Cryptogenic just means we don't know what caused it. Okay? All your things have come out normal. We don't know. Okay? Cryptogenic, unknown cause. So let's start with ischemic. Ischemic means a blood clot, thrombus, blocks the artery. Okay? Blocks the artery. Hemorrhagic. Hemo means blood. Okay? Hemorrhagic occurs when blood vessels either in the brain, we're going to call that deep, or on the surface of the brain. What was that word 2 weeks ago? Superficial. Okay? Leaks, the vessel's leaking, or it broke. Okay? It leads to swelling and or pressure and can damage cells and tissue of the brain. Example, aneurysm. Okay, brain aneurysm. Okay, vessel aneurysm. Have aneurysms in your abdomen. We'll discuss that on another time. Tonight's not it. Okay? Think about brain aneurysm. You might have had a family friend, co-worker, yourself may have had a brain aneurysm. That means it's kind of like a bubble. It can leak or it can burst. Okay? That would be a hemorrhagic. If it causes you to have a stroke, left side, right side, face, vision changes, that would be a hemorrhagic stroke, okay? Because the vessel has either burst or it's leaked, okay? All right. TIA, just discuss that. What is it? Transient ischemic attack means a temporary blockage of blood flow to the brain. It doesn't damage brain cells at all or cause permanent disability. Okay, so we have the first one. Ischemic means, example, I think I have a picture in a second. The road, say you have a forked road, okay? You can go this way or this way, okay? But one side One side is totally blocked. Okay? So you'll have to go, the blood has to go this way. It can't go this way. So whatever is over here on this side of the road, okay, it's not getting any blood flow. So we just learned that's not good. Okay, it has to have blood, either going fast as it can, of your blood pressure, going normal, or slowly. Okay, it's got to get something, or it's going to damage whatever is over here. Okay, so, but TIA means it's still getting through, but slower. So it may get a lot of flow and then slow flow. A lot of flow and then slow flow. Okay? So small little clots, not one big one. Okay? Or plaque. Okay? It's getting through, but it's going slower, and it's not all the time. It's intermittent. Okay? It's not causing any damage right now. Now, obviously, if your clots, little small clots, come together and cause a big clot, then we got to talk about ischemic. Okay? The big ischemic, not the transient, not the every once in a while. Light stroke, mini stroke. Okay? That's TIA. Okay? So tiny little blood clots are they're getting through, but they're not causing any damage yet. Okay? So, like I said, think of it as a roadway. Okay? You're on a road. Let me see if I can find an example. We're just going to take internal and external. It doesn't matter if it's backwards, okay? So the blood comes from the arch. It goes up. It can go this way or this way. All right? Simple. Okay? So here is our road. You can go left. You can go right. Okay? So if something is clogging the left side, it can only go right. Everything on the left, if you follow this vessel up, everything there is going to be affected because no blood or slow blood or every once in a while blood is getting through the left side. But on the right side, everything is flowing fine and we're all good. Okay? It explains the fork in the road type of thing as far as the vessels go. Okay? So the ischemic is like having a roadway, fork in the road. One side is blocked by a clot. So traffic is getting through only on the left or only on the right, which is opposite of whatever's blocked, correct? Okay? So whatever's not getting any blood is going to be affected. Okay? Hemorrhagic. Both lanes are open. Okay? Both lanes are open. But say here, let me hope it stay up. I didn't think it would. I'm going to give it another one more shot. So both are open, but you see that little vessel? Say this